Good morning. Yesterday, as we watched history unfold at St. Louis City Hall, we also saw it unfold in Minneapolis with the verdict in the George Floyd case. The swearing in of Tashara Jones was a room full of hope, a nod to a future that will include voices of those often left out of the conversations. In Minneapolis, the verdict brought hope to our communities of color that an interaction like the one that occurred between George Floyd and a police officer will not go unpunished. For way too long, hope has yielded little else. Equity, like hope, is not a buzzword. It is necessary to the success of St. Louis and the whole region and the whole country. Mayor Jones and I met last week to talk about the ways we could work together. Our conversation quickly turned to public health. The pandemic has brought to light once again the inequities in healthcare based on where you live and the color of your skin. We must embrace these truths to make a real difference, and that is what we've done in our response to this pandemic. We continue to break down barriers to getting vaccinated, just like we did with getting residents tested a year ago. Our focus on equity and serving our most vulnerable populations has led us to create an array of opportunities for county residents to get vaccinated everywhere. Over the next several weeks, we will have events specifically for those who are hard to reach when it comes to providing both vaccine education and access to these shots. Our Department of Health has created community outreach groups, and we are working with places of worship, nonprofit agencies, and others that work with vulnerable populations to reach as many people as possible. Yesterday, we offered our first walk-up vaccination sites at Hayman Park Community Center in University City and at Queenie Park. The walk-up site at Hayman will be available again tomorrow from 9 a.m. to noon. No appointments are required. Similar events are planned throughout the county. The goal is to bring the vaccine into as many neighborhoods as possible. While large-scale vaccination sites receive a lot of attention and do serve an important purpose in our response, we know that they cannot be the only path provided to a vaccine. Last week, for the first time, we had unfilled appointments. The people who have the means and the desire are getting the vaccine. It is these smaller efforts that get us deeper into the community and provide wider access. That's the public equity, and that's our ongoing commitment. The Health Department is working with the Department of Human Services and shelters in the county to vaccinate the unhoused. We're also planning to offer vaccinations at drug treatment centers in the area, and we're offering the vaccine to those housed in our Justice Center, as well as their family members who visit them. As local governments responded to the pandemic, they often did so in different ways. Governor Parson left decisions to counties and cities on how to best move forward. And as the pandemic continues into a second year, Mayor Jones and I have pledged to work closely together to see what opportunities there are to collaborate in ways that will make our region healthier and safer. As Mayor Jones said the night she was elected to lead the city, this is an opportunity for us to rise, and we are done avoiding tough conversations. We are done ignoring the racism that has held back this city and held back our region. When I took office 2 years ago, I agreed that we would finally address our region's biggest challenges. And that includes systemic racism. That includes leaving too many people behind and bringing too few to the table. And that means working with other regional leaders to address complex issues. And responding to a pandemic is certainly complex. It requires partnerships, and it requires us to respond in an equitable way. And that's the path we are on, and that's the one we'll stay on until this pandemic is eradicated. Thanks, and I'd be happy to take questions.
Dr. Page, we have some questions today from Channel 4. You addressed some of this in your comments, but what was it like to see Tashara Jones, the first black female, inaugurated as mayor of St. Louis?
Well, the question from Channel 4 is about the inauguration yesterday, and specifically Tashara Jones as the first black woman mayor of the city of St. Louis. And as I said in the beginning and yesterday, this really is a historic time for St. Louis City. It's a chance to address some of the serious questions that we've been talking about in our community. I think she spoke very eloquently about her goals and her policy directions in the city of St. Louis, and you'll see a very similar approach here in St. Louis County.
Turning to the verdict in the George Floyd case, what reforms do you want to see in our area immediately?
Okay, the question is about reforms in public safety in our area. I met yesterday with Dan Oates, who is a former police chief, who is leading the review of our St. Louis County Police Department with Teneo. And we had a good conversation about the Teneo report, which is available online. I would encourage everyone to take a look at that and where we're going in St. Louis County. I'm very pleased with the cooperation of the police department and the investment and engagement in the police department in these conversations. There's certainly, we hope to see a wider engagement in our community with emphasis on community policing, emphasis on diversity and equity in the police department, with police officers and with how police officers communicate. Our police officers have raised some very significant questions regarding promotions and promotion policy within the police department. We're going to be addressing that as well. But in general, we'll be moving through that report very methodically to address operational issues within the police department, crime fighting strategies, and the way the police department interacts with the community.
A couple of related questions turning to the State Health Department. What do you think about Dr. Williams' departure, and do you want to see this health department go in any other direction as a result?
So the question is about Dr. Williams and his resignation from the State Department of Health yesterday and the appointment of a new acting director. St. Louis County has historically for decades enjoyed a very close working relationship with the State Health Department. We do so many things operationally together, and we've worked very closely in response to this pandemic. Dr. Williams presided over the Health Department in a very difficult time in our history, and we're grateful for his service, and we are moving forward with the new leadership. Our public health staff in St. Louis County will continue a close working relationship with the long-term employees at all levels in the State Health Department, and we'll continue working very diligently to get vaccine into our community and into as many vaccination centers as possible to make it as easy as possible for people to get vaccinated.
And we have a couple of questions about the public health protocols here in St. Louis County. Noticing that more and more people are going out to restaurants and seeing some evidence of social distancing not being followed. Is the county still enforcing this, and is the county still getting complaints when it comes to these types of violations?
So the question is about social distancing and public health safety protocols around restaurants, how closely they're being followed. We really aren't seeing a lot of complaints about public health safety protocols, social distancing in restaurants. Historically, throughout all of this, all of our small businesses, including our restaurant business sector, has just asked us what's the right thing to do to keep our patrons safe and our employees safe, and that's what we want to do. We work very closely with our restaurant advisory group. We're in constant conversations with them, and we are in discussions now about how we might be able to ease some of our protocols around restaurants and other gatherings. We'll always follow the direction of our public health experts. We'll be talking with the pandemic task force. We'll look at the scientific evidence as it continues to evolve surrounding these mutations, and we'll do what's safe. But we really don't see a lot of complaints in St. Louis County throughout all of this. Just about everyone has approached this as what's the right thing to do, what's the safe thing to do to keep us safe, keep our patrons safe, keep our employees safe, and that's what we see.
That is all we have for today.
Thank you.